Hi, I'm Dr. Swati Kanakia, a paediatric hematologist oncologist from Mumbai. This video is about the bone marrow test. But before we go on to discuss the test, let me tell you what is the bone marrow. It is the soft tissue in the center of some of the bones of the body. It is a factory that manufactures blood and manufactures all the cells of the blood, the red blood cells, the white blood cells, and the platelets. So when does a hematologist oncologist like me ask for a bone marrow test? It is done to see whether the bone marrow is making adequate cells, that means whether the cells are enough or not, whether they are too little or they are too much. It is done in cases when we want to rule out a leukemia or any other malignancy or cancer that is affecting the bone. We do it when there is no cause which we can find for fever, and it can also be done for monitoring the progress of treatment. For example, we are treating a patient with leukemia and we want to see whether the chemotherapy is working or not. In that case also, we would like to do a bone marrow. How is it done? It's a fairly simple test in experienced hands. So the child is put on the side. We expose the backbone like this. A small injection is given over there, and we draw bone marrow in the syringe like this. Whatever marrow has been drawn or has been taken out from the bone, some of it, a little bit is used on slides to make smears, which are then seen under the microscope, and some of it is kept and preserved in test tubes like this, where it can undergo further testing. All parents are very worried. Sometimes parents don't want to get the test done because they think that it will cause a lot of pain and the child will not be able to bear it, and they don't want to put the child through so much of pain. Let me assure you that we do it under a very short GA, that means a general anesthesia. The child really doesn't feel any pain. Even after the procedure, if there is pain, it can be very easily taken care of with the help of medicines. So please don't get scared to get a bone marrow done, because sometimes it is very important to make the correct diagnosis, and if you delay the diagnosis, then of course treatment is also delayed. If you've already got a bone marrow done for your child, then what are the things, or what are the steps that you have to take? So let me just tell you quickly. Do not wet the area for 12 to 24 hours, and so there can be no bathing or swimming. My patients are generally very small, so they wear diapers. I tell the parents that please make sure that the diaper is not soiled or wet, and the dressing of the bone marrow doesn't get dirty, because then that can cause a lot of problems and infection. In case of excessive pain at the site of bone marrow, swelling, redness, if there is bleeding from the site of the bone marrow, please contact your doctor immediately. Friends, thank you for watching. I hope it was useful. This is part of an educational initiative by the KRK Foundation. The idea is to give medical information in simple terms so that patients and parents can benefit from this. Thank you so much. However, friends, let me also tell you one more thing before I sign off. This cannot replace your doctor. It cannot replace the advice from your doctor and pediatric hematologist, oncologist. So please contact them at all times. Thank you so much.